Welcome to the Dr. Washbrains Podcast, where we're making health a dinner table conversation. I'm your host, Dr. Akash Sehgal, and today we're diving into a crucial topic that affects everyone: your blood. Specifically, we'll be decoding the results of a common blood test called the hemogram or complete blood count, CBC. We'll explore what the numbers mean, how they reflect your health, and what actions you should be taking when something is off. Whether you have recently had a CBC done or are just curious, this episode is for you. Let's break it down. So, first things first, what is a hemogram? Hemogram is composed of two things, two words, heme and gram. Heme stands for iron and gram denotes quantization, not Instagram. Simply put, it's a blood test that gives you a snapshot of what is happening inside your bloodstream. Think of it like a report card for your blood. It measures various components like red blood cells, white blood cells, platelets, hemoglobins, and a few other things we'll get into. Each of these plays a specific role in keeping you healthy. And if any one of these values are too high or too low, it can tell your doctor a lot about your current health. Now, I know it can be daunting to look at those results, but by the end of this episode, you will be equipped to understand the key numbers in your report and what they mean for your health. So, a hemogram test includes three components: CBC, PS, and ESR, the complete blood count, peripheral smear, and erythrocyte sedimentation rate. PS is a microscopic slide that is created to look at everything in the blood on a microscopic level, and ESR is used to detect inflammation and infection in the human body. Let's start with red blood cells or RBCs. These cells are like the delivery trucks of your body, carrying oxygen from your lungs to the rest of your body. A typical RBC count ranges from about 4.7 to 6.1 million cells per microliter in men and 4.2 to 5.4 million in women. In newborn, the count is 3.5 to 5.2 million cells per microliter, and in children aged 1 to 6 years of age, the count is 4.5 to 5 million cells per microliter. So what happens when these numbers are off? Now, if your RBC count is too high, a condition called polycythemia happens. It is like having too many trucks on the road. Delhi traffic. Your blood gets thicker, which makes your heart work harder to pump it. You could be at a risk for hypertension, strokes, or even heart attacks. Chronic causes include chronic lung disease, commonly caused due to smoking and lung infections. Humans living at high altitudes can sometimes face hypoxia, renal cell carcinoma, dehydration, or the use of anabolic steroids. Now, if your RBC count is too low, you're dealing with anemia. Now, anemia is a big one. It can be caused by anything from iron deficiency to chronic illnesses like kidney diseases. Vitamin B6, B12, and folate deficiency also causes anemia. Malnutrition, bone marrow cancer like leukemia, multiple myeloma, internal bleeding can also cause anemia. Symptoms of anemia include fatigue, shortness of breath, and dizziness, and if left untreated, it can lead to more serious complications like heart problems. Now, for the patients, if you're feeling unusually tired or if you're out of breath after minimal exertion, ask your doctor about checking your RBC count. Anemia is often treatable with dietary changes, supplements, or more specific treatments depending upon the cause. Now, closely related to RBC count are hemoglobin and hematocrit. Hemoglobin is the protein in red blood cells that binds oxygen together. Normal hemoglobin levels range from 13.8 to 17.2 gram per deciliter for men and 12.1 to 15.1 gram per deciliter for women. And it is around 11.5 gram per deciliter in newborns. Now, why does this matter? Well, hemoglobin is essentially what gives your blood its oxygen carrying capacity. If it is too low, you're not getting enough oxygen to your tissues, which can lead to similar symptoms such as anemia. On the other hand, if it is too high, it can again indicate conditions like polycythemia. Then there is hematocrit, which measures the percentage of your blood that is made up of red blood cells. Hematocrit levels should be between 40.7% to 50.3% in men and 36.1% to 44.3% in women. Low hematocrit, like low RBC count, signals anemia. High hematocrit can indicate dehydration, chronic smoking, or other conditions that reduce the amount of oxygen in the blood. For the patients, Keep an eye on your hydration. Dehydration can also skew these numbers higher than they actually are, giving the impression that something is wrong when you might just need water. Now, let's talk about the size and content of your red blood cells. The mean corpuscular volume, the MCV, the mean corpuscular hemoglobin, the MCH, and the mean corpuscular hemoglobin concentration, the MCHC. The MCV tells you the average size of your red blood cells. Normal MCV is between 80 and 100 femtoliters. If your MCV is high, you might have macrocytic anemia, which could be due to a vitamin B12 or folate deficiency. Symptoms can include fatigue, tingling in your extremities, and even memory issues. A low MCV, on the other hand, could point to microcytic anemia, often caused by iron deficiency or conditions like thalassemia. Iron deficiency is very common, especially in women due to menstruation or pregnancy. The MCH is the average amount of hemoglobin in your red blood cells, and MCHC measures how concentrated that hemoglobin is. Low MCH or MCHC typically signals iron deficiency anemia, while higher values may indicate macrocytic anemia. For the patients, if your doctor tells you that your MCV or MCH is abnormal, it is important to ask about vitamin levels. B12 and folate deficiencies are often overlooked and can have significant impacts on your energy and overall health. Next up, we've got white blood cells, the WBCs, your body's defense system. A normal WBC count is between 4,500 and 11,000 cells per microliter. If your count is higher, this could mean your body is fighting an infection, dealing with inflammation, or responding to stress. Extremely high levels can be a sign of more serious conditions like leukemia, which requires urgent follow up. Now, if your white blood cell count is low, this can make you more prone to infections. This is common in people undergoing chemotherapy, or those with autoimmune diseases, or even people with certain viral infections like HIV. Then the differential WBC count. It looks at the different types of white blood cells. The neutrophils respond to bacterial infections. The lymphocytes deal with viral infections. Monocytes, eosinophils, and basophils are involved in fighting off other infections and allergic reactions. For the patients, if you're often sick, a detailed WBC differential can help figure out whether it is bacterial, viral, or related to some other underlying issue. Let's move on to platelets, the cells responsible for blood clotting. Normal platelet counts range from 1,50,000 to 4,50,000 per microliter. A high platelet count or thrombocytosis can put you at risk of developing blood clots, leading to complications like strokes or heart attacks. This is often seen in chronic inflammation, infections, or certain cancers. A low platelet count, known as thrombocytopenia, could make you more prone to bleeding and bruising. It is often caused by conditions like autoimmune diseases, liver disease, or bone marrow problems. Finally, there is mean platelet volume or MPV, which measures the size of your platelets. Larger platelets can indicate that your body is producing platelets rapidly, while smaller platelets can point to issues with platelet production. To the patient, if you notice frequent bruising or prolonged bleeding after small cuts, get your platelet count checked. It is crucial to identify the underlying cause early to prevent serious complications. Lastly, let's talk about erythrocyte sedimentation rate, or the ESR, which measures how quickly red blood cells settle in a test tube over a specific period. Normally, in men, ESR is up to 15 millimeters per hour, and in women, it is up to 20 millimeters per hour. A high ESR often indicates inflammation. It is a non specific test, meaning it won't tell you exactly what's wrong, but will suggest that your body is fighting something, like an infection, autoimmune disorder, or even cancer. To the patients, if your ESR is high, do not panic. This is just a clue that more tests are needed to find out why your body is inflamed. It's like a red flag that alerts your doctor to look deeper. So, what should you do if any of these numbers are off? The most important thing is not to jump to conclusions based on a single abnormal result. It is essential to consult your doctor for a full evaluation and possible retesting. Many factors like hydration, recent illness, or even medications can temporarily skew your results and give false impressions. Your doctor will look at the bigger picture, possibly recommend more specific tests, and guide you on the next steps. In some cases, managing skewed hemogram results is as simple as improving your diet. drinking more water, or taking supplements. For instance, iron supplements can help treat iron deficiency anemia, while vitamin B12 shots can resolve macrocytic anemia. But in other cases, like with significantly high or low white blood cell counts, more complex treatments may be needed, such as antibiotics for infections or even chemotherapy for conditions like leukemia. For the patient, you got to keep in mind that one abnormal test does not mean something is drastically wrong. Follow up with your doctor, ask questions, and understand that your hemogram is just one part of the overall health puzzle. Now, let's talk about prevention. How can you avoid skewed hemogram results? Now, while some factors like genetic conditions or chronic diseases might be out of your control, there are several steps you can take to keep your blood healthy. The first step is having a balanced diet. Ensure you're getting enough iron, folate, vitamin B12 through your diet. Leafy green vegetables, meats, and fortified cereals are excellent sources. The next thing is to stay hydrated. Dehydration can affect your red blood cell count, the hematocrit, and even platelet volume. Drinking plenty of water can help keep your blood flowing smoothly. Then you gotta exercise regularly. See, moderate exercise helps improve circulation, it boosts your immunity and maintains a healthy balance of blood cells. Next, you got to avoid smoking. Smoking can increase your RBC count, hemoglobin, and hematocrit, which may cause complications down the line, especially for your cardiovascular system. Chronic stress can raise your white blood cell count and trigger inflammation. Mindful practices like meditation or yoga can help maintain a healthy immune system. For the patients, if you're at high risk for anemia, infections, or clotting disorders, regular health checkups can catch any changes early before they lead to complications. So, what's the key takeaway over here? A hemogram is more than just a list of numbers. It is a vital tool that helps you and your doctor assess your overall health. Whether it is red blood cells delivering oxygen, white blood cells defending against infection, or platelets controlling your bleeding, each component has its role. And when something is off, it can be a clue that your body needs attention. But remember, these results are not standalone. They're part of a bigger picture. If you get abnormal results, do not panic. Work with your healthcare provider to dig deeper and understand what your body is trying to tell you. To the patient, always advocate for yourself. If you do not understand your test results, ask questions. Your health is a partnership between you and your doctor, and it's important to be informed and engaged in the process. See, all of us doctors love to get asked relevant questions. I was just watching something, I believe, on the internet, and I came across the term cyberchondriac. Yes, some people are hypochondriacs in nature, and it's fine, it's okay. We don't like cyberchondriacs. You've come to us for our opinion, for our knowledge, for our wisdom, and whatnot. Let us be providing you with all of the information that you need. That's all for today's episode of the Dr. Washbrains Podcast. I hope this deep dive into your hemogram has helped demystify those blood test results. Understanding your hemogram can empower you to take better control of your health and have more meaningful conversations with your doctor. If you found this episode helpful, make sure to share it with your friends and family because health should always be a dinner table conversation. Thank you for tuning in. Stay healthy, stay informed, and I'll catch you in the next episode.